So, of course, we want contingencies, and that's why we've offered those expressions of interest so that we make sure that we don't waste any doses. I think Susan Pearce would be probably thousands booked in today. Yes. Yes.
Last week's positive case, the identity of Barbecue Man has been published today. Given that he did everything right in regards to QR codes, reporting where he'd been, is it a little disappointing that could put people off?
I'm incredibly disappointed, and I think I've stood up here every day, and I've got to say I really respect the way the media hasn't pushed me mercilessly when I've said I won't give them the exact age or I won't disclose something. So for me, that was really when I became aware of that late last night, we immediately, one of our senior public health physicians reached out to the gentleman to make it clear that that information in no way came from New South Wales Health. And that was not in accordance with the wishes of the gentleman. And I think that we do need to be very thoughtful. I mean, in the end, we rely on people sharing the most blow-by-blow descriptions. I can't imagine this gentleman has had calls probably 2 or 3 times a day. He's helped us recreate his walking route. He's helped us go through every credit card time-stamped. You know, he's really gone above and beyond to help us. And I think that it's not a good outcome from public health when that happens. We obviously take the approach that where we need to, we will be very frank with any information, but that was not necessary.
Sorry, just...
Sorry? I think it's absolutely appalling. No journalist should think that it's okay to go naming a patient, somebody who's working with health. It's the quickest way to destroy the confidence of all of us if we think that some journalist somewhere thinks that it's okay to name a patient who is actually working with us to make sure the community stays safe. It stinks, actually.
Can I just ask, we're obviously searching for the missing link. Is there any chance, I'm not sure where the specialised health accommodation is and how close they might be in proximity to the venues that this man visited, is there any chance that it could be direct from the returned US traveller during that period when they were transported or potentially even airborne or through an air conditioning system?
So, look, we're investigating all lines of inquiry. Obviously, the direct route has the most appeal. We've reviewed the CCTV footage. We have recreated the gentleman's walking route to see if there would be any opportunity for crossover. At this stage, we haven't found that. Clearly, this gentleman was in the city area and some of his walking routes did take him down around the precincts of the quarantine hotel. But we have looked at the vision of when the patient was transported and can't see any way in which the gentleman would have been directly exposed, but our lines of inquiry are continuing, and that's what I'm saying. This gentleman has taken multiple calls as we pursue and get additionally new information to actually figure out how the transmission event.